I couldn't believe it all happened to one family, and I couldn't believe that the family stayed together. And the sisters were much more upbeat on the phone because they believed their story had something to teach people about the nature of schizophrenia. They believed their family was scientifically significant. As soon as I got on the phone with the medical people who had researched the family, I saw that this was a big story, not just a science story, but a family story. I couldn't believe how little the general public, even mildly educated people like me, don't know about mental illness.
And so maybe they do things out of character or that seem bizarre because there's some sort of impaired reality that they feel. They might say, in order to save the world, I've got to walk into this fire. And to them, in their brain, they had to do it. It was compelling, and it was something that they must do. So it's pretty typical that people are going to have an experience like that is just bizarre, and unfortunately oftentimes comes to the attention of police or an emergency room versus necessarily the right type of psychiatric treatment. So it's typically about 18 to 25 is going to be when this happens. It typically affects men and women equally. The difference is that often that prodrome can look like a depression. And so more often women will seek treatment. They'll say, I'm feeling depressed, I'm not myself. So they might go in and get a diagnosis of a depression and then have their psychosis emerge later. And so they might have a diagnosis of depression with psychosis than men who typically, when they present, have come to the full force of a full psychotic episode. We kind of look at schizophrenia as a spectrum of different experiences, and the different symptoms fall into a couple of different categories. We offer it the same way you might offer options for birth control. There's a pill you could take every day. There's an injection you could do. Here's all the options. What's going to work for you in your life? It's one of the greatest things we've been able to offer to the family members, because it's devastating for them too to have, see their young person about to flourish and then have this setback. So if we can offer some hope and recovery and support, and that, they did probably go through this alone the first time, and if it happens again, they're not going to be alone.
Hope is that readers with mental illness in their lives or in their family might read this book and see, how far we've come from those days and how we might be more on high alert for acute mental illness now, hopefully.
That's what is going to help us lessen the stigma, advance more treatments, get more care, get people into care earlier, so that, if somebody noticed a loved one, they wouldn't be scared, like, oh, I don't want to broach this. They can say, hey, I've heard of this. I have some knowledge about this. And there's help for you out there that's help you get to treatment versus isolating away from people. Or we do know there's a genetic vulnerability, and we know that an environmental stressor often is the cause of the psychosis, or to kind of turns it on. And so that's really hard because we can't necessarily predict who it's going to happen in or what kind of stressor. To know our family history and know if there's something that we need to watch out for. If there was schizophrenia in the family, how can you watch out for that moving forward? So there's a bigger picture of, we need this service, but we also, we need help with legislation, we need help with awareness, we need help with startup funds. All of those things can help us make this service available to people, because it's heartbreaking when a person goes through this type of experience and the actual evidence-based treatment isn't there for us.
I'm grateful for Dr. Cowdrey and everybody doing work for early intervention. I think one thing this book drives home is the need for first episode type work. So I'm just overjoyed to be able to do whatever I can to bring attention to it, and I hope people donate.